One of the things I hear a lot these days in COVID times is the symptom that people complain of brain fog, both when they have COVID and sometimes even for months afterwards. So I think it's really important to consider ways to optimize our cognitive function and first understand why it might be off a little bit. When we think about brain function, there's a couple areas of the brain that we think about. First of all, there are the cells of the brain themselves, where memories in certain parts of the brain may be stored, both short-term memory and long-term memory. Then there are the connections between the brains. So those neurons have to be connected in order for us to retrieve some of the information that we have stored in the brain. So many different aspects of our daily life can affect how well we can both store and access what we know in our brain. The first of these being sleep. So sleep is a time, especially deep sleep, when our body is resting, healing, and repairing. But in addition to our body doing that, our brain is doing that as well. And during deep sleep is one of the times where we take our memories or the things that happen during the day and move them from short-term memory to long-term memory, where we can access them for a greater period of time. And as people have more trouble with cognition as they age, let alone with COVID, what we see is that people can remember things from long ago, but you can't remember what you had for lunch yesterday, or you can't think of somebody's name that you just met. Those are issues where you're not moving the short-term memories to the long-term memories. So sleep is one big important factor. The next thing is stress. So in the adrenal glands, where the stress hormones are made, the master hormone in the adrenals is called pregnenolone. And pregnenolone is a precursor to many of the other hormones in the adrenal glands, like cortisol and DHEA and testosterone. However, it's also a very important hormone for our brain, for cognition, memory, concentration, focus. So when we are under stress and the adrenal glands are stressed and not functioning optimally, that hormone can decrease. I use the example when we're activated, when we're in fight or flight because of an acute stressor, whether it's, and believe me, these days stressors are traffic, work, deadlines versus running from a wild animal or starvation or things that early humans used to face. What happens is your body goes into action mode. It's not a thought mode. So when we're very stressed, it's very hard to calmly think about things, and it's also hard to incorporate new memories and new information into our brains. So sleep and stress are critical factors. Inflammation is very important, and I think inflammation is one of the reasons COVID has so affected brain function for so many people, because when there is inflammation in the brain, that can affect cognitive speed, it can affect mood, it can affect memory, concentration, and focus. So anything that you can do to decrease inflammation can be helpful. And whenever I think about reducing inflammation, I always go right to diet and nutrition and avoiding foods that might be inflammatory. The most inflammatory food is sugar. For many people, not all, gluten can be inflammatory, and gluten is a protein that's in wheat, barley, rye. It's in many foods that we eat. And again, not for everyone, but for many people, cutting that out of the diet completely can decrease inflammation and lead to better cognitive function. Dairy in some people can be another inflammatory food. Soy can be inflammatory. Sometimes corn and other grains can be inflammatory, and that's all very individual. Weight, so when we are overweight or obese, particularly the fat around the belly can increase inflammation markers both in the blood and the brain. So weight loss, movement, and activity can be very beneficial for brain health. Exercise, one of the studies in older adults is that exercise can actually increase and improve brain function and memory by 200, 300 times. Way more than even just doing brain exercises like crossword puzzles or other cognitive tasks. So again, some of those core pillars of health that apply to all topics that we discuss, like sleep, stress management, exercise and movement, apply to brain function as well. And then finally, hormonal influences on the brain. So all of our hormones, women and men all have estrogen, progesterone, testosterone, thyroid. All of those things are critical for brain function. If thyroid is low, the thyroid gland sits in the neck and it regulates energy and metabolism, but it's also important for memory, focus, and concentration. So if thyroid's low, that can lead to cognitive slowing, cognitive dysfunction, brain fog. As women lose their estrogen at perimenopause and menopause, they can start to become more forgetful. Particularly, what estrogen does is it increases the connections between the brain cells. So when women are having trouble with their cognition because of loss of estrogen, it's usually not that they have completely forgotten what they're trying to remember, it just takes them a while. So they might think of the name they were trying to think of the next day. So it's there, it's just because the connections are less, it takes longer to access that information. And then testosterone is also very important, both in men and women, for the sharpness of thinking, etc. So again, addressing all those lifestyle issues, hormone balance can help with brain function. And then, there again are various supplements, herbs, minerals, vitamins that are known to be what we call nootropics, 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 which mean that they're good they help the brain function. Adding some of those supplements to lifestyle changes can be very helpful in improving brain function.